Hello, 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 and welcome to the Breastfeeding Café. Please, we want to extend our welcome, but also say we are really sorry for the delay. We have delayed the start of this live because of a glitch. It was a technology glitch that we had to deal with. So please join in, come back, tell the others to come back if they had joined and disappeared because of the delay. But we're really excited to be here to talk about real life experiences with regards to breastfeeding, and not just what's in the books, not what is the ideal, but what really happens to moms, right? So welcome. Let us know where you're logging in from. I'm in Nairobi. Let us know where you're logging in from. I'm going to be your host today. My name is Millie. You also know me as Ciera, a nurse midwife, a doula, a childbirth educator, and a board-certified lactation consultant. Really happy to be here. As you know, I'm passionate about supporting, educating, and empowering mothers through their pregnancy journey and beyond. So that's what I do on a daily. And as a lactation consultant, I'm always supporting moms, and I know the real deal, the rawness that you experience in hospital and in your home. So I'm not only here as an expert, but I'm also here as a mom. I'm a mom of 3, and very recently I was awake with you breastfeeding our babies at 2 or 3 a.m. and I continue to breastfeed. So I am joined by an amazing woman, a doctor by the name of Dr. Jemimah Kariuki. She's a brilliant woman, a mother, an advocate on mental health. And I'd love for you, Dr. Jemimah, feel very welcome to this live hosted by Maziwa. If you could just kindly unmute, show us yourself, and introduce us. Tell us a little bit about yourself.
Hi, how are you? Thank you for having me. I'm really happy to be here. My name is Dr. Jemimah Kariuki. I'm an obstetrician gynecologist. I'm a Kenyan mother. I'm a mother of 2. One is 4, the other one is 18 months. And I love advocating for women. I'm the founder and CEO of Wheels for Life. Wheels for Life is a platform where we take care of women, especially those pregnant, those in their motherhood stage. And we work with them up to 2 years of postpartum. And the emphasis on making sure that they're doing the breastfeeding, immunization. It's a doctor-led platform. We have gynecologists, we have pediatricians. I'm glad now we have a new lactation specialist that we can call on to. We have sleep specialists. Everything that a mom may need, we try and put it on the platform. We have an app on the same and the WhatsApp channel just to make it easier for moms to follow with us. And I'm glad to be here to speak today about breastfeeding.
Wonderful.
And the background, you'll hear my babies, so please forgive me in advance.
No, it is understandable because this is prime time in our homes, prime time. So I'm hoping even as the moms are continuing to watch and listen, I know they're busy doing a lot of stuff supporting the children. So welcome, Dr. Jemimah. Thank you for sharing a little bit about Wheels for Life. For those of us who are joining now, we've just started the live at 6:20, so you're not late. Just let us know where you're logging in from, and we'll be happy to have you. Please ask all the questions that you have. You have the access to myself, lactation consultant, as well as Dr. Jemimah, who is an OB-GYN. So I want us to talk a little bit about what no one really told us about breastfeeding. Even as experts, even as a nurse midwife, you as a doctor, there are things you will learn on the job. And one of the things, maybe if you allow me to share my story, with my 3rd born, even with all the knowledge that I have, I still struggled. And I struggled because babies are very different. The same way pregnancies are different, babies are different. So I gave birth, and of course I'm going to breastfeed, and I do start to breastfeed, but I get really engorged on the first day. I get engorged, and my dear friend Esther comes to visit me the day I'm being discharged, and she's like, "Oh my gosh, Ciru, your breasts are quite big and full." And I'm like, "Yeah, and baby is not even feeding long enough. So she's like, you know what? I have a cup in my car. We usually have these nifty cups that we support our mothers with for babies who are not being able to breastfeed, or if she has too much milk and she's not going to use a bottle. So she goes to her car and gets the nifty cup, and I come home with it. And that's what I used that first day, because my baby is tired. They're tired, they're not breastfeeding enough. I'm full, so I need to express out and then cup feed. The other challenge I had for the first, I think, 4 or 5 weeks, I couldn't breastfeed on my right breast. I'm the same one who will come to you, mamas, and tell you, okay, hold your baby. Okay, have a baby here. I'll tell them, hold the baby in a different position. So I'm here trying to hold my baby using the football hold, and then this other side, I do this way. I still try that. I'm struggling. This baby is not latching. I'm like, okay, how is this not happening? So what I did, I said, you know what? It is well. So she can latch on the left side. So I'm going to latch her on the left side. I'm going to express on the right side to make sure my milk supply, is not, doesn't go down, doesn't dip. But eventually, things aligned, our planets aligned, and she was able to latch on the right breast. But I genuinely really had an issue. I'm like, what is it? And when she latches, I feel much more pain than on the left side. Why am I sharing this story? I'm sharing this story for you to know that even me as a lactation consultant, I still struggled with my breastfeeding, and I needed support. I needed a colleague to come to my house and tell me, by the way, Ciru, try it this way. Try the lying down position. Because sometimes you don't even think about it. You're like, by the way, I haven't tried the lying down position. But every mother needs support. Now, Dr. Jemimah, many times in hospital, we tell the mom, weka mtoto kwa matiti, nyonyesha mtoto, breast is best. But do we really give them the immediate breastfeeding support that they need to be able to succeed? What do you think? Maybe share that.
I think I concur with you. I had taken for many years, I was guiding women on breastfeeding, having no children at all. And then my firstborn came, and logically I was supposed to have known. Like, I knew the science behind it. I knew the oxytocin, the prolactin, the baby positioning, the suction. I could see he had the reflex. I was checking all those things, but this baby was not feeding. This baby was really not
Yeah.
feeding, and it was pain. It was so painful. No one prepared me for the pain of the first letdown.
Mm.
Hi, what was that? Like, it was so painful. And then and then the other thing is, I expected that milk would come down immediately. Logically, I could know, I knew I didn't go through labor. I didn't go through labor. My baby had some small, I had complications in pregnancy. I had gestational diabetes, and then we had to get the baby out early. I was not allowed to go into labor because my baby was big. So at that 7, I think you were hitting 4.1 kilos. So I didn't go through labor. I had no
Wow.
oxytocin. And then now I have this huge baby to breastfeed. And he's hungry. Like, that baby was hungry. And nothing is coming out of my milk.
Yeah.
I tried. They gave me all types of lactagogues. I was put on, I was given everything possible in the hospital to help me get milk. It wasn't until the day of discharge, after I walked out of that door, that my milk poured. I think the whole hospital environment was stressful. And then now as a patient, because home a doctor. And then I felt very inequipped in matters, positioning of the baby. How do I get this baby on one line? That's actually how Wills for Life was born. That's when I realized you need more
Yeah,
education.
moms need the support.
But yeah, because I could see I'm trying this, it's not working. I never even tried the football lift to date. I never tried. But this lying down position, it's not lying down. My breastfeeding is not the easiest. And then around 5 months, my baby grew teeth. My baby started teething early by around this firstborn. Around 2 months, he had the first two teeth. In fact, I thought it was like there was a problem. And then they got the next teeth, and then I was like, okay, we're okay. And then he started looking for teethers, and he was strictly breastfeeding. And so who is he feeding on? Me and my
Mommy.
breast. My God. Ah, yeah. So I didn't know about giving babies carrots to teach, to nibble on, and I didn't know all these things. In a long story short, that's how we stopped breastfeeding with my firstborn because one day he beat me. I felt so much pain. I spanked his bum, and then he told me, "Mom, you and your milk can stay. I don't need you. I don't need you. I don't need you at all." And then I went to work, and then I'd come home with my breast full, and I was
Mm.
struggling with hand pumping, something I didn't experience the second. At least I had a wearable pump. But with the first one, I'd go to the car and I'm pumping and pumping and pushing and pushing and putting the milk there and rushing to another ward round and coming. And so I'd pump like maybe once a day. So I'd get home with such full breasts, and then
God.
I'd just shower and try give the baby, and he would choke on the milk because the pressure was so much. And then I'd be told mtoto nimempea maziwa imeganda. I'm like, how are they gandaing in my boob? As in, there's just so many stories.
Actually, we need to share the myths. The
Yeah,
myths
so I think
out there.
there's so many. There's so many. And no one tells you these things. And as a doctor, you know this is nonsense. But you start wondering, is that why the baby is getting a cough? Is that why they're getting colicky or gas? And it's just because there's just too much pressure and he was regurgitating. Anyway, there's a lot I learned on the go that I decided no one would have to go through that.
Yeah.
Let's just teach moms, you know. But yeah, that was my experience.
Thank you so much for sharing that. And it's amazing. You expect that you're a doctor, the same way you tell your moms just breastfeed, you realize it's not that easy. You even start feeling so guilty. You're like, oh my God, why did I
Yeah.
treat my patients like they were even fussing about struggling to breastfeed? And yet it can be a challenge. But I think what
Yeah.
I'd like for you to know, struggling doesn't mean failure. It's okay to struggle in the beginning because it's a dance between you and your baby. You're both learning how to get that dance and the rhythm together, and eventually it actually just works out and you don't need to endure breastfeeding. Breastfeeding should be something that you're enjoying. However, Dr. Jemimah mentioned myths. There are many myths, and maybe if you can write in the chat the myths that you've had. For her, she was being told maziwa imeganda, if she's not expressed for too long. That one I've had so many times, and I'm always like, imagine the milk is still sterile. Okay, the milk is sterile. Then the other one is about the breast size. If you have a large breast size, then you have more milk. If you have smaller breasts, you have less milk. And there are those who say the opposite, that those with large breasts have less milk. And it has only everything to do with the size of not your breast, but the alveoli in your breast, the milk producing glands. Other myths are you'll spoil your baby, you'll have saggy boobs, breast milk is not enough. Which other ones do you know that I've not mentioned, Dr. Jemimah?
Hey, the saggy boobs was a thing. What?
Yeah.
Oh, and I was told I needed to wear a bra 247 because if I
Uh-huh.
don't, they just drop down.
Mm-hmm.
Um, that there are particular foods you can't eat because of breastfeeding. Street chilies will do what to the milk? Yani, there's just a lot out there.
So what do you tell your moms about that, about diet? Are there foods
Imagine
they should avoid?
I think food is very cultural. Sincerely speaking, I think it's very cultural. And every culture has their own foods that they advise everyone to eat when breastfeeding. My advice is just to check what's giving you gas. If it's giving you
Mm,
gas, it's likely to give the baby gas. So I advise that you can eat everything. But if you start noticing when I eat such, but keep a food kind of a it's called a food what diary,
right.
so that
Mm,
if you eat today, let's say I'm Kikuyu, so we're given jahe and njogo. So those are like black beans and some type of beans that are said to be very good with milk production, and they are, by the way. But I would notice that anytime I eat that, I would feel very gassy myself, and then baby would struggle to poop or just feel gassy. You can just see this baby is wincing and colicky, so to speak. And I would
Mm.
omit only those ones and then introduce it again in like 5 days and see if the same would happen. So that's what I
Mm.
advise. Whatever you guys have in your culture, you proceed. But put a food diary and notice, what did I eat here that may have affected me or may have affected the baby.
Yeah.
So I'm not very picky because my patients, some are vegetarian strictly, some are they eat everything, some are not allowed to eat, I think, some certain types of fruit. Medically, you can eat anything apart from coffee, and even that coffee, it's just 1 cup that we advise you can take daily, and because it can just stimulate the baby, not anything
Mm.
else. So
Mm.
that's what I advise.
Yeah. At the food diary, I'm always talking about do a food diary, write everything you're eating, because then, as you've mentioned, that you're able to keep track and see, actually, when I ate this, 4 hours later, my baby seemed to be gassy and
Mm,
I felt gassy. Okay. So
mm,
have a well-balanced diet and also hydrate, drink water so that then
mm.
you get, because 87% of breast milk is water. So
It's
you need to
actually
be,
water.
yeah, so you need to
Mm,
be well hydrated. Now, moms are struggling with latching, and latching is painful. And then making it difficult to enjoy breastfeeding. And then with that, it affects their mental health because you have the mental pressure, you want everything to work out right. Everything is not working out right. Yeah. So you start to have mental distress. And I think I'd like for you to touch on that, Dr. Jemimah, in terms of lactation failure and height can cause even postpartum depression. But at the same time, how moms, if they are struggling mentally, they are crying as they're breastfeeding their baby. That's not entirely normal, especially if your baby is above 2 weeks.
that's true. Um,
Yeah.
yeah, so we have postpartum blues and we have
Yes.
postpartum depression. Um, and it can be any postpartum anxiety. I think anxiety tends to lead to the depression later on, but typically there's a lot of pressure on moms to be super moms. I don't know how to say it. There's a lot of pressure that when this baby comes, you need to bond immediately. And sometimes it just doesn't happen. Especially I've noticed when mothers have delivered normally, like at times you tell them to hold this baby and their hands are just all over the place. They're tired, they're exhausted, they've been pushing for hours, and then here you are, you're like, hold your baby, shikilia mtoto vizuri, shikilia sianguke, so there's that 1 hour contact that we advocate for. But sometimes I've seen that there are mothers who simply cannot. And when you give them time and when they're rested, now they come back from whatever state there was and they're happy with their babies, they're breastfeeding, they're excited for this baby. But it doesn't happen automatically, and that's not failure. The second thing I notice is that there's pressure to breastfeed. Mama, umenyonyesha mtoto? Have you started breastfeeding? Are you sure? Have you put the baby? Is the baby latching? This baby has a good sac reflex. What's going on? Let me show you. And then now the let me show you is another 20 to 30 minutes of either someone with a syringe trying to pull your, your breast for you, or just hold this. And can you just support the baby's head like this? And it's a lot of pressure because you're like, I thought this thing is natural. It's just supposed to come. And it's not as natural as we think. And it's only until you notice how your baby learns how to walk and talk that you realize that it's a progressive thing. Like learning anything natural is actually a progressive thing. And to give yourself the grace to learn how to breastfeed. And I've learned to call on lactation consultants earlier rather than later. Like it's right in the clinic. Can you before I discharge you, please have a visit with so and so. I think she's struggling. Just have a look and see. And I've noted it gives women more relaxation because I find lactation consultants a bit kinder. There's no word round they're rushing to. I don't have 4 patients in queue or 5. Like they're a bit more kinder and patient with the moms. Uh, so that really helps. But also this understanding that it's not automatic. I think people think breastfeeding is automatic, and it's not. Even the first letdown is painful, as I said. And as you start, the release of oxytocin that's making you get the milk also pushes the uterus to contract and go down. So it's a natural mechanism of healing that God put in place, but it's a painful natural progression of healing. So
Yeah,
you'll
true.
feel those cramps, you'll feel them, and they're not, if you're not aware that they'll come, you'll wonder, do I have another baby? Am I in labor again? So I think we need to stop glorifying the process, because people see breastfeeding at the end, after the 2 month mark, when mom is relaxed, there's a rhythm, and everything is in
Yes.
line. There's a nice
Yes.
picture, someone is smiling, carrying a baby. And therefore, when that doesn't happen, or that difficulty of that, it pushes one to stress, and then that stress reduces the milk, and then that reduction of milk puts you at more stress, so it reduces even further. Then you get stressed. That stress goes to your brain. You start getting anxiety. Your blood pressure goes high. High. You don't want to see that baby because you feel like you failed the baby. Then you start crying. You take the baby to nursery, give that baby formula. The baby should not be on formula. I've failed the baby. There's so many thoughts that come back to back. And I've
Yes.
experienced them. I told you, the first baby, hi, for the first 2 days I had zero milk. And they've been taught breast milk is the best.
Yes.
Um, so I think when one starts noticing that I'm not bonding with this baby, I'm trying to distance myself, I feel like a failure. It's good to reach out early. Reach out early to a community of moms. Just find out from older moms, younger moms, how does this go? And they'll tell you their own sub stories, and you'll realize, we're all the same.
Yeah. I've
And
gone
then,
through
of
what I'm
course,
going through.
exactly. And then you also hear the tips and tricks of how they went about it. And then
Yeah.
now also getting experts in the field to help and support you. And
Yeah.
experts, especially when you have anxiety, depression, include your obstetrics gynecologist, includes your psychologist or your family therapist, includes a psychiatrist if now we feel you may need medication as well. So, and there's no shame about it. It's an illness such as malaria. We treat, we recover, we move on, and life moves. And then I
I
think also
know.
not alienating yourself. There's this pressure on moms to do everything. You want to be the one to dress this baby, hold this baby, breastfeed this baby, carry this baby, put them to sleep. You don't want hubby to touch this baby. Mom-in-law, maybe you can't do everything.
Yeah.
And allowing yourself to get help, especially on breastfeeding, is really, really important. And if you're the type who was expressing, give a bottle, let hubby also try. If you can go to your community, like your mom is around, your mom-in-law is around, your sisters can come in. Hi, they take so much pressure off, and this breastfeeding becomes so much easier. Yeah. So that would be what I'd advise.
No, thank you. You've covered so much, and I hope the ladies are enjoying and hearing what you're saying because it's important information. If you have any questions, please put them in the chat because we'll tackle them towards the end. But I'd love for you to tell me one of the things that you dreaded with regards to breastfeeding. What is that one thing nobody told you about, or what's that thing that you dread with regards to breastfeeding? So for Dr. Jemimah, I feel that the healthcare system tends to fail moms who've gone through a cesarean section. And I'll tell you why. One, me in my training, I know as a midwife, immediate skin to skin contact, put the baby on the chest within the first hour of birth. Now, when that happens, it's actually supposed to be an uninterrupted 1 hour of skin to skin. Now, you've gone to theater. You either have the spinal or you had a GA because maybe you woke up and you started to feel the pain or your heart rate was going up, blood pressure is going up. Why I feel we fail the moms, one, I think she can be supported to have the baby skin to skin on her eventually when she's put in, she goes back into the room from the recovery room. The second thing we fail as healthcare workers is the baby. The number of times babies are given formula because the mother needs to rest. And the formula they are getting is like 5 times more than they need to take. Because remember, the baby's stomach should only take in 5 to 7 ml per feed because it's really tiny on day one. I come and find the baby has been given 40 ml, and I'm like, oh my God. The baby is having milk coming through the nose, spitting up. Why? They're so full. Now we set up, I'm saying we as healthcare workers set this mother-baby dyad for failure because the baby's stomach just becomes big, yeah? So they're supposed to have 5 ml. Now they're at 40 ml. Because they are at 40 ml, the mother is always playing catch up to try and meet the demand of the baby. So that's two people we are failing, especially for moms who have gone through cesarean section. And I don't know moms who are on the call if you've experienced that or if you've had any struggle immediately. The third thing is what you mentioned about how the nurse will come, will put the boob in the baby's mouth, okay, put it, help you latch, but doesn't give the mom an opportunity to actually practice it on her own. They just like, okay, yeah, put the baby, you've latched, then she goes. Now when you're left in the middle of the night, you're struggling, or you go home, you're like, how was it done? How did she actually get this baby to latch? Because the baby latched okay, and I didn't have pain. But now when I'm at home, I'm struggling. The reason is because we are not allowing these moms to practice. Yes, there's shortage of staff, and there's no time. And that's why lactation consultants just need to be integrated into the healthcare system. But hey, Dr. Jemimah, back to you. What are your thoughts on what I've just mentioned?
Yeah, I think cesarean sections is one of the areas of struggle, because that 1 hour, first hour is lost. Yeah. And it's sad because there are times when we try to give the baby, especially with patient pediatricians, we see that like they'll hold the baby for the support and have at least 15 minutes of breastfeeding. But then after that, the procedure has to continue. It's not as smooth lining as it was as it was before. If it was a normal delivery, you still have to close the uterus and whatnot. And then after that, there's that whole 2-3 hour of rest as the mother is in PACU and then recovery. So I don't know, in the public healthcare system, once you leave CS, we give you the baby immediately. So sometimes you're not so sure what's better because now you have a fresh cat and a baby on your side and you have to share this bed. So and then the other is now that the baby is taken to nursery until you're ready, but they'll be hungry and then they're given this formula feed. And then now by the time you come, this baby is so used to high amounts, and then now you have to play catch up. So there are like two evils that are fighting to I don't know, serve one another. I don't know. But I think the advice I usually give to my CS moms is that to give yourself grace. That milk supply will not be immediate and it will, that you may struggle quite a bit. But I agree that there needs more time with people who are patient with you to teach you how to breastfeed, especially for the first baby. And sometimes you're in your third born and you think you know how this thing works, and then you realize, the syllabus changed. The syllabus changed because CBC. So I think just having guidance for every mom, it doesn't matter because they're patient. And I'm being honest here. There are times I come and you're like, oh, this is your third baby. Veteran, higher bus, continue. And then I come the second, I'm like, but this baby is standing yellow. What's wrong? Let me see how you're feeding. Do you have milk? You get so small things like those ones. If we are able to give each patient detailed care, especially first-time moms, then I think we will better help our patients. And I agree, lactation consultants should really be integrated to every maternity. I think it really has good impact.
Yeah, thank you. And I think where we fail, we also imagine she's a third-time mom, but she's a first-time mom to this baby. whether it's her fourth, her second, her fifth. She's the first time to this baby. So the experiences are very, very different. So we shouldn't assume that, she's a veteran, go ahead and breastfeed. But yeah, she's going to struggle. So I'd like to switch gears and talk about the madness of going back to back. Here we are. World Health Organization says 6 months exclusive breastfeeding. And we are like, you're going back to work. It's 3 months, or if you're lucky, you've gotten that extra 1 month. 4 months you've been home, and you're looking at your baby, you're like, how am I leaving this baby with? Guy, because they still are small. I mean, for me, a 4-month-old is still small and still needs me, but you have to go back to work. So let's talk about that madness, because you're trying to work on your supply. You've realized your supply has dipped. You're going back to work at the time where your supply tends to naturally dip and stabilize around 3-4 months. You don't have somewhere to express. You don't know your right as a mother who is lactating, because you have rights according to the Health Act of 2017. You have a right to be able to get time off. But I'll tell you that after Dr. Jemimah has spoken. So you're struggling. You have no tools. You didn't think about a breast pump. So now you have you're doing by hand. You're trying to work it out, go into the store, in your office, you have no room. It's crazy. Don't you think so? So let's talk about that. Real life experiences. Maybe you can share your real life experience, because you had started to share it, that you're out of a ward round.
Yeah,
and you're
so
for
sure. So I think going to work is like the biggest thing I fear about breastfeeding. You asked me that question, I didn't answer. I think that's my greatest fear. And having experienced it the first time round, second time I was ready. I had a manual pump, an electric pump, a wearable. I started, I think, pumping week 2. In fact, in my mom's fridge, I still have a frozen breast milk supply for my baby. I pumped it, I think just 2 months ago. 2 months ago.
Yes.
Hey, I pumped, you guys, pumped. And then that whole pumping journey, I think people also don't understand how hard it is. Because one, as you mentioned, there's no particular room. And for the ones where you have a particular room, you all tend to pump at the same time. So you're like 4-5 moms in, each with their own method. So you all have your boobs out. This one with the manual pump, this one with the electric pump. We're looking for sockets because electric pump. And then this one walking around with the wearable pump. And I didn't like it. I was walking around with a cool box, as in everyone knew we were pumping. I had a project. The project was my daughter. Don't care what you think about it. That's the project. Because and why I was so passionate about it is because I stopped breastfeeding my firstborn at 5 months, and it made me feel like such a failure. Because I literally went back to work at 5 months. So it only took 2 weeks for that system to shut down.
Wow.
Because when I was at work, he was he's a big baby. So they finished all the formula in the house. I think we were going through a teen in 4 days or 5. Yeah. Yeah. And then one day they just decided this lady is not coming. So they made porridge. They gave my baby. Exclusive feeding went like that. I was like,
the decision on your behalf.
They made it on my behalf. I was like, okay, fine. I waited to see him puke or anything. He was just fine. In fact, the next time he was just looking at my food and eating it. I was like, okay, yeah, Amanda. So it made me feel really bad that I could not support him after many years of talking about exclusive and this and that. I couldn't support him all the way through it. And my transition to work was not mentally prepared because I think I had targeted at stay 6 months at home, and then we were just called back to the ward, and I was like, okay,
Hmm.
so what do I do? Yeah, but that said, the lessons that I learned from that was that early preparation is key, especially if you want to keep breastfeeding. My second one made it to 11 months. 13 months, 1 year, 1 month.
Good.
I even had to stop her because I was like, now you're training me. Now I'm tired. You've done enough. But and I went to work early. I think at 4 months I was fully at work. But
Hmm.
because I had learned about stashing up stock, I would pump like 3 hourly the way you do as a newborn.
Hmm.
And why 3 hourly? Because I went from pumping 300 mLs to 50. I was like 50. In fact, there's a video I was doing and I had
Yeah.
10. I was like, 20 minutes of pumping and you got 10, Mima, 10? What is this supposed to do with this? As in, it's not even an appetizer at this point. I don't know what this is.
That's
Hi.
so fun. But
Yeah,
that's
so
the reality of
it
how your
is a
milk can
reality
be.
for sure. And I think it's good to let people they can get 10, especially
Yeah.
the first week of work when you're stressed and 10. And I got this 10 consistently. So I moved again from 10 to 30 to 45, all the way up to back to the 200s, 300s.
There you
But
go.
it takes a lot of work and dedication. And when I realized that my work environment was not allowing me to have, to have privacy,
Hmm.
I'd go to the consultation room and close it for 20 minutes. It's my lunch break. You do what you will. I'm pumping. If the consult room was not available, I'd go to the car and I'd walk around with my cool box and my ice packs very comfortably. And sometimes I'd drive, I was in Nakuru, I'd drive till Naivasha and back. And I'd use the drive because it was an hour as a power pump. I'd pump,
Mm.
pause, sit,
Wow.
stop the car, put that stash, go pump again. By the time I'm coming home, the milk that doesn't have so much pressure, so she doesn't gag. She didn't have agitation issues because by the time I'm coming, the milk doesn't have so much pressure. So lots of lessons learned, but I think it's doable. And I say that cognizant of the fact that not everyone has a car that they can drive pumping. Not everyone has that luxury. But where I work now, we have 3 moms who are actively breastfeeding and working. And we see they go in phases. This one has finished, then the next one says, okay, Sasa, I've gone to pump. The next one goes, Sasa, I've gone to pump. They eat lunch together. In fact, now they make porridge in the clinic. They make porridge together, they drink it. Yeah.
Yeah. The
And
community.
then
So
community.
yeah,
That
they
community
encourage
is
each other.
important. Exactly. And
And
then
if
they
one is
pump and then they go home. Yeah.
And if you start to feel like you're giving up, you're like, hey, the other two seem to be really going for it. So let me just keep going. So for me, what I've had
Exactly.
from motherhood takes a lot of dedication. Yani, umejitolea yako yote. You're tired,
Kabisa.
you're on a drive, but you're like, let me use this time, right, to express. So, for those who are listening to us, I want you to take note of that. That it takes dedication. It just takes commitment to know I'm just going to do this for my child because I know I'm building their immunity. I'm making them stronger. The milk that I'm providing for them is the best. Yani, it has the best of everything to meet their nutritional need. Okay. Now, the other thing Dr. Jemimah has mentioned is that her supply was at 300. I hope you had that. Then she goes back to work. It comes down to 10 ml. 10. And she's like, oh my God. So what tends to happen? Maybe people quit. But they don't realize, imagine you keep pumping, yes, you get another 10, you get a 30. Don't be disheartened. Keep pumping. The trick about increasing supply that I keep talking about is the more you pump, the more milk your body will produce. So don't get discouraged. It's very easy to get discouraged when you're getting the 10 ml, but keep at it. If you're an exclusive pumper, 8 times a day, you should be pumping. Okay, so when we're talking about pumping, we have very many different types of pumps. Okay, we have the hospital pumps, especially for moms with babies in NICU, that is neonatal ICU. Those tend to be very convenient for them. That works really quickly and is very, very powerful. Then we have the single or double electric. Dr. Jemimah, you can mute a little bit. You can mute your side. You have the single or the double electric pump, which you have to sit down and hold or wear the bra that can support the pumps, and it just pumps for you, okay? Then it has the portable electric ones that you can wear, which are quite powerful. I think there's Medela that has one. Now, Maziwa has the Wema pump. It's a discrete pump, and it's a wearable pump. It's hands-free, and it can be a lifesaver for you who is either in a matatu going to work or in a car driving to work. You can be pumping as you're going about your day. You could be at your desk, you've worn the pump under your bra, and it pumps for you, okay? And then we have the suction pumps, which are the non-motorized pump. You've heard of these, it's a silicone one that you attach on your breast, and it sucks out the milk for you. Many times you're encouraged that if the baby is on one breast, for those who are trying to increase their supply, they can attach it on the other side. It is a pump. I find it's a pump because it doesn't have a motor. You're not having to do this, but because it has a suction effect, it does the let down. It does encourage more and more let downs. So those are the different types of pumps. And as I've mentioned, the Wema pump is one of these pumps, which is a wearable and a discrete pump. So plan yourself as you're planning on going back to work. Start planning ahead. What pump will I use? Am I going to have a wearable pump? Am I going to have an electric pump? Where will I be pumping? Ladies, you have a right. According to the Health Act of 2017, you're allowed to be away from your desk to pump for 1 hour. And this 1 hour is on top of your lunch break. Now, you don't have to take the entire hour. You can do 20 minutes in the morning, 20 minutes at lunchtime, and then another 20 minutes. So a total of 60 minutes of pumping in the workday is what you're entitled to. Number 2, you're entitled to have a lactation room. According to this Health Act, your organization should provide a space for all lactating moms or lactating employees to go and either breastfeed their baby or to express milk wherever. So as long as there's a couch or a chair, there's a water place where you can wash your pump pads, of course, wash your hands before you start. There's an electric point, preferably there's a fridge as well to store the milk once you've pumped it. So you need to start planning, even talking to your human resource managers to help set up these spaces. And I'll tell you, if you've been there before, you know how important this is, okay? So I want you to also know when you're thinking about a breast pump, you also need to know your flange size. What is your flange size? That is crucial. Most breast pumps have a size 24 millimeter flange size, right? But we have one breast could be 24 and the other nipple is a 20. Okay, some of us I have different size. One size is bigger, the other side is smaller. So you need to be able to measure your, where is my, yeah. You need to be able to measure your nipple. From here, you take a tape measure and you measure, take this pen, this side, okay? This nipple all the way to this other side, okay? You do not include the areola, just the nipple. So whatever measurement you get, so let's say you measure this nipple, looks a bit small, so we'll say it's like a 16, we'll say it's like a 16, so you add 4 millimeters, so you can use flange size 20. Why you're adding 4 is when you express and pull the milk out, the nipple tends to swell. And when it swells, then it might start rubbing on the sides of the flange. You do not want that to be happening. You want the nipple to be nicely smack in the middle. It goes in and out, in and out, in and out without rubbing on any side because the friction can really hurt you. Okay, I just thought it would be important for me to mention about pumping, the different pumps that we have available. and you needing to know that it's your right to get this extra time even once you go back to work. And you can even ask for to be able to do hybrid and flexi hours once you go back to work, because it can be really, really difficult. And the main reason why your milk supply is going down is because of stress going back to work. At the same time, you're not pumping as many times as you are at home. Maybe you are just breastfeeding and now you're not breastfeeding because the baby is at home. You are one biological unit and now you've been separated. That also brings stress. Now this one biological unit, one is at home, one is at work. So when you're at work, you've got to try and pump at least every 3 to 4 hours when you're at work. One thing I'd mention is when you're home, you've breastfed your baby or you've expressed. When you get to work, before you start opening your emails and checking all the information, all the meetings that have been set up for you and all the workload that you have, because you're not as stressed in the beginning. Yes, you had pumped maybe an hour and a half ago, pump again. And then now look for 2 other times you can pump. No more than 30 minutes, 20 to 30 minutes is enough for you to pump. So I hope that information is important and you've learned something, because it can be a lifesaver to have planned before, get the right tools to help you succeed so that you get to exclusive breastfeeding until 6 months. So, Dr. Jemimah, we are going to turn and move to the F word. And the F word is a breast milk substitute. I want you to guess what word that is. And I find it is very easy for doctors to use it when a mom comes to say, look, I'm struggling, I'm having pain, I'm not sure whether my baby is getting enough. And then the doctor says, but why can't you just, these days it's all available. Why can't you just use the F word? So what am I talking about?
Yeah. Yeah. So, formula. I have a very interesting relationship with formula. I'm not against it at all. But I advocate for, if we can breastfeed, let's breastfeed. I find formula fed babies have more constipation, they're more predilection to diarrhea. They tend to get bigger as well, or smaller, depending
Formula
on,
fed. I hear you say breastfed,
yeah,
formula
fed. So formula fed tend to become either bigger or smaller based on who's taking care of this baby at home. And they're not cheap. It's one of the most expensive ways of raising a baby. But for patients who have had, for example, postpartum anxiety, depression, and all that, or who are really struggling, I tend to say just, and this is me, Jemimah, as the gynecologist who takes care of the mother before anyone else. I tend to advise mothers to have it there. Don't use it, but just have it, so that even as you're breastfeeding, there's an option that you can go to. If it's giving you anxiety levels enough for me to have to start you on hypertensives, like for me, your mental health is more important than anything else. That said, I think breast milk is the most wonderful thing God created. And I'll say this. Anytime you're on formula, for example, it's the same thing. It's what is put in that cup at the point of the factory or processing is what you're going to give the baby. But when it comes to breast milk, if your baby has a cold, for example, your body is able to pick up those antigens. Are you settled? Your body is able to pick up those germs or those bacteria that are in your baby's tongue, such that it goes to the mother's body, creates the antibodies that this baby requires, and this is passed down to the baby. That's one of the most protective things I've ever seen. And especially when the kids were unwell, Sometimes my firstborn would get unwell and I'd feel so bad because I was like, if I was breastfeeding this baby, we'd be well by now. We'd be well by now. My body would have known what to do to fix this baby. You find you don't need antibiotics, you don't need antivirals. Sometimes even for the vaccines and the fevers they get, you give that baby the boob and that baby settles. Yeah. So it's one of the most protective things that God created, and it's versatile. What I gave the baby today is different, and you can check, especially if you formula feed, you can know when your milk is different. You can see this one has a yellow tinge, this one has a yellow. This
When you
one is like
breastfeed.
when you breastfeed and then you pump, you can tell.
Yeah.
If you go back, you can tell this time I was unwell or baby was unwell. Like it's literally very, very different. Yeah. So it's something that is versatile. Or if you take a lot of, let's say, what is candy, like maybe aloe vera, the lot is maybe to taste it and like, but we'll keep breastfeeding.
Yeah.
Like, what's this new taste, mom? What is this? What did you introduce to the diet today? And they pick up those tastes as well, so that you find if you're comfortable with chili, the baby is comfortable with chili, and you think it's genetic. No, it's because of what they got when they were breastfeeding. Yeah. So I find breast milk to be the best, and it's always in the right temperature. There's nothing as bad as the baby is screaming at 2 a.m. and you're trying to look for the right temperature water to try and make this formula to give this baby. You're
Cool.
like,
Yeah.
I'd have finished by now. I'd have finished by now. This baby
Oh,
would be
sweet.
back asleep by now. So
Yeah.
small things like that, I feel like. And you can be with your baby on breast milk, assuming there's very intense drought. You can feed that baby for 1 year. In fact, there's a doctor who says you can feed your baby on 5 years. You just need to add porridge. You just need to add, because it's highly nutritive, like, and it responds to the baby's needs. So I know we have formula. I know it's an option. I've used it, and I wouldn't lie, I've used it, especially with my firstborn, because the milk just stopped pop like that. But I've seen the benefits, especially having fed one for longer than the other. I've seen the benefits of being on breast milk. And the other thing is that there are different types of formula. So you may give your baby formula and they're allergic to, or they're lactose intolerant or whatever, and you don't know, and they keep getting eczema and allergies and whatnot, yet you should have been on maybe the hypoallergenic one. Or your baby is regurgitating and then you're giving them the normal formula. Sorry, mama. You're giving them the normal formula and then it keeps coming out and you find it in the nose and the nose. But if you give them the AR type, you see, now if it was breastfeeding, should have been better by now. So if you give the AR or the anti-regurgitating formula, it's thicker, so it helps them settle more, so they don't regurgitate. So I think it's also important, if you're looking at formula, discuss with your pediatrician that they give you the right one for you. Don't just don't ask your mom which one is best, so which one can I try. Go and discuss with the pediatrician and let them guide.
Yeah. And even talking to other moms, which formula you on, and then you just go buy that one. Yeah. Now, one of the things I don't do, I don't encourage moms to buy formula and keep it there. The reason why I don't encourage them to buy formula and keep it there is because I find that it's a backup plan. As a just in case plan, it's like I'm letting them know breastfeeding is hard and there's a chance it's gonna fail. And I don't like that, because then it shakes up the mom's confidence on breastfeeding. She's like, okay, it might fail, so let's just use it. Then she ends up using it earlier than she needed to. Maybe all she needed to is seek my help or any other lactation consultant out there, or lactation specialist, or go back to the doctor and say, look, I'm struggling. But you end up depending on the formula, because you keep thinking, no, I don't think I'm doing well. And especially if even the husband has said, by the way, I think baby needs formula. And you're like, oh my God, if he's saying that the baby needs formula, you've been thinking it, but you've not acted on it, then you're like, okay. And then the doctor said, oh my gosh, let's do it. But what happens? It will eventually affect your supply. So you start to breastfeed less, meaning your milk supply will come down because nature abhors waste. So your body realizes, oh, we were producing 750 and only 400 is being taken out. So guess what happens? It comes down to 400. So then you end up being more dependent on formula. And then eventually you become fully on formula, and then you stop breastfeeding. It happens many, many, many times. And I'm not only saying this because I'm a champion for breastfeeding and I think you should do it, but I also understand that there are moms who struggle. Their babies are either having an issue with their milk, they're reacting to something, maybe the mom is eating and she just feels it's better that I formula feed, or for whatever health issue, then you can use that substitute. But I do not suggest that moms should have it, because then they stop even seeking for help. They stop thinking that, okay, maybe I should find a lactation specialist to come and find out what the problem is. So it's important to reassure you that to know that breastfeeding can sometimes be a struggle, but it doesn't mean that you're going to fail. All right. There's a question here. The question here is, how do you know when to stop breastfeeding and switch to formula? How do you know when to stop breastfeeding and switch to formula?
I think it's not something you decide. And now let's stop breastfeeding and now let's use formula. I think going to formula is our last resort. There has to be something that has really sorry for that. That has really caused you to need to go to formula. For example, let's say you are HIV positive, for example, and you've been exclusively breastfeeding, and then you come home and you find that, well, in your absence, someone started giving the baby formula. So now you can no longer exclusively breastfeed, you need to switch. Okay. Or let's say you are you're going through whatever type of medication and you're not able to then you're not able to breastfeed because the medication will pass on to the baby. Okay, it's time for me to leave. But then you need to then switch to formula. But beyond that, if it's a supply issue, you try as hard as much as possible to breastfeed. Try as much as hard. If the supply is coming down, do power pumps. Do a 1 hour power pump, 20 minutes, break 20 minutes, another 20 minutes, break 10 minutes, and then you're done. So doing power pumps, looking at your diet, improving that before now you say, okay, now let's switch to formula. I think would be the way to go. For me, formula is the last resort, and it has to be really, there's nothing else you can do, and this is the only resort that I have. Yeah, I think the only times I advise formula feeding is when moms tell me, my baby is not getting enough. I've tried talking, I've tried everything, I've taken. Now I want to give Uji to a 3-month-old. Please buy formula. you know.
No, oh my God, that poor gut. Their gut.
Please to achana na ugali Uji, just please get formula then. Yeah. But if it's not something like that, then I would suggest work with your lactation specialist, work with your pediatrician, mama. And then you will get to try and get your breastfeeding.
Before you go, I want you to tell us a little bit about Wheels for Life. But to answer this question, on top of what Dr. Jemimah has said, every drop of breast milk counts. Every drop counts. So I wouldn't encourage you to stop breastfeeding. If you're happy to continue with that relationship with your baby, continue to breastfeed. And if you have already started formula and you're very dependent on it, it's fine. But please just know that every drop of breast milk counts. That drop has so many microorganisms that are beneficial for your baby, for their microbiome, their gut, their everything, their IQ. All of that is important for baby, okay? So please don't stop if you can. Now, Dr. Jemimah, tell us a little bit about Wheels for Life. I know you mentioned it in your intro, but just let us know more about it. How do people join? and things like that. We actually have a minute to get to an hour. So
Yeah, we have a minute. Thank you so much for having me. Wheels for Life is a platform that we started actually for maternal transport. It was a COVID response. I saw that women were dying and the babies were getting bad outcomes because they couldn't get to hospital. And I thought it was because of the curfew. After dealing with more than 10,000 women, I realized it was not just transport or curfew. There was lack of education in terms of preparation. At 9 months, people didn't know where they're going to deliver, didn't have savings for that delivery, were dependent on Linda Mama that's now not there. Like there was a lot of gaps in terms of education and patient education. So which is what made us start the WhatsApp group and the app. So we have two WhatsApp group. We have a free platform and a 100 bob membership fee. It's 100 bob a month only. So we decided to make it $1 a month or 100, it's even less than $1 now, so that moms could benefit from having webinars every Thursday. So today this will will replace what we usually do.
okay.
To have doctors on the platform 24/7. So anytime you have a question on which medication should I give, so instead of moms responding now, we as doctors are like, no, 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 no. How are the fevers? How are these? Please, let's go to hospital. And we interpret that for the patient. Have super moms. Our super moms are our best thing that happened to us because we have moms who've gone through trouble breastfeeding, moms who've gone through struggles with pregnancy. Now I'm dealing with nutrition, marriage, everything in that group, but it's a mom community. And I think
Wow.
that's the best thing that we could have. How does one join? I'll send a poster to Ivy. But on our Instagram, YouTube channels, Wills for Life by Dr. Jemimah. It's just you pay the 100 bob to our pay bill and use your account, use your WhatsApp number as your account number, and then we add you onto the group. That's for WhatsApp. On the app, it's on Play Store, it's on Apple Store. It's called Wills for Life. We have two, and Wills for Life Physician, but Physician is for doctors. It's more doctor facing. May not benefit everyone, but Wills for Life on both Play Store and app and the Apple Store allows you to plug in, get our lectures, get our education channels, get all these things that we do on YouTube there. Get a whole course on pregnancy and breastfeeding. I mean, we've tried to put everything pregnancy, motherhood related in
Wow.
that space. So I hope to have all of you there and that we
Yeah.
can walk this journey together. Yeah.
That's beautiful. That's so amazing. I can see the passion that you have to want to walk this journey with the mothers. And I know being part of such a community is what makes a difference. Just feeling you're in a safe space, a place where you can get expert information and also interact with other moms who are going through the same thing you're going through in whatever stage or season that they may be in motherhood. So I think we've come to the end of our live. I'd love for you to just share some emojis and likes and any emoji that you want for what we've done today. We've had an hour together. It's been wonderful. And remember, you're doing a good job as moms. And let you know that Maziwa is here. Maziwa Breastfeeding is here to walk this journey with you. Go to our website. I don't want you to breastfeed in isolation. The support is there. Look for the information, look for the experts so that then you can succeed and enjoy your breastfeeding journey. So that's it from me. Kwaheri, have a lovely evening and goodbye. Thank you so much.